This 50-year-old female coming from the ER with abdominal pain. Start by scanning the pancreas. Obtain an image of the pancreas.
Okay. Do I need to annotate at all?
Yeah, you
Yes,
can.
please. And take the picture.
And then name 2 things you might be looking for in the pancreas if your patient has abdominal pain.
You may be looking for a mass in the head of the pancreas or acute pancreatitis as well.
Okay, and what do you see with acute pancreatitis?
The pancreas is going to be, it could be normal, it may be enlarged, swollen, and the duct could be dilated as well.
Okay. So if you have a pancreatic mass, does that cause abdominal pain?
It could, because it can obstruct the CVD.
Okay. And what else can it obstruct the pancreatic mass?
The pancreatic duct as well.
All right. And what's the upper limits of normal for pancreatic duct?
2 or less.
Okay. What structure courses along the posterior of the body and tail of the pancreas?
The splenic vein.
Okay, and then get a waveform of the splenic vein and then store that in place.
Okay.
Okay, and then you can store that if you didn't already.
Okay. I'm just trying to get it.
Okay, so what direction is that blood flow going?
It's going towards the transducer.
I mean, and then anatomically, what direction is that?
It would be from left to right.
Okay, and then, so from what organ to what organ is that going to?
The vein would be going from the spleen to the portal confluence and then into the main portal vein.
Okay. Name 2 symptoms your patient might be experiencing if they have acute pancreatitis.
They may have nausea, vomiting, and epigastric pain.
Okay. Now we're going to switch to the liver. Show me and store an image of the hepatic veins.
Alright, take a big breath in for me. Hold it. Take one on the right. And breathe.
And then what conditions should be ruled out regarding the hepatic veins?
Budd-Chiari.
And what is that?
That's when there is thrombus in the hepatic veins or the IVC.
Okay. Where do so you already mentioned it, but where do the hepatic veins go?
Into the IVC.
And then from there?
They go into the right atrium of the heart.
Okay. So can you show me the direction of flow in this model and the hepatic veins? Yeah.
Alright, big breath in and hold it.
Okay, so what direction, when you see that blue there, what direction is the flow going?
That's going away from the transducer and it's going towards the IVC.
Okay, so is that the normal direction?
Yes.
Okay. What disease process other than fatty liver can lead to liver being enlarged?
Hepatitis.
Okay, and what else?
It can also be enlarged with acute, like the cirrhosis when it's in the first stages.
All right. Anything else that can enlarge the liver?
Other than fatty liver,
Mm-hmm. Or somebody has a primary cancer somewhere.
like Mets or hepatocellular carcinoma, those
Right.
types of tumors.
It's important to remember that, so if somebody has a liver full of Mets, a lymphoma, the liver can be enlarged, and you can actually monitor the change in the size of the liver as sort of like a representation of overall amount of disease in the liver. So you can have a liver just full of Mets, and then when they get treated, the liver will actually shrink because the Mets are shrinking. So
Okay.
that's another, just cause it's probably more common. All right, let me have an image of the right lobe of the liver sagittal. And you can store that.
The dome specifically, Caitlin.
The dome?
Yes.
Okay.
What she said.
Thanks.
Okay, and then 3 sonographic findings we would evaluate in a patient with cirrhosis.
So is this like initial or once it's in later
Your
stages?
choice.
Okay.
You know,
So you would look for nodular borders or regular borders, ascites. If it's in the later stages, it's going to be shrunken and very echogenic.
okay. Beyond the echotexture and size of the liver, what other process do you look for with cirrhosis?
Initial stages, there will be hepatomegaly, and then you can also have splenomegaly and portal hypertension as well.
Okay. And when you have portal hypertension, what else are you going to see?
You're going to see initially the main portal vein will be enlarged, and then there will be cavernous transformation around the hilum of the liver. And you could also see some hepatofugal flow.
Okay, so cavernous transformation is what?
Those are just collateral vessels that go around the main portal vein to bring blood flow.
Okay, because of what?
Because it starts to thrombose.
Right, that's okay. All right, we're going to switch to the gallbladder. Show me an image of the gallbladder sagittal.
All right, take a big breath in for me. Breathe.
Okay, so if, and then you can store that when you're ready. So your patient has abdominal pain. With this symptom, what disease process are you looking for regarding the gallbladder?
They have abdominal pain. You would look for cholecystitis.
Okay, and then just give me 3 sonographic findings of cholecystitis.
Wall thickening, pericholecystic fluid, and sludge.
Okay. And if they don't have stones, then what do you call that?
Acalculous cholecystitis.
And who's susceptible to that?
Those are really sick patients. It's going to be when there's like decreased flow in the cystic artery.
Okay, and what other kind of patients? So you said sick patients,
Mm-hmm.
and there's another category. Or another patient population, so ICU patients and then something else. Okay, we can get back to that.
Okay.
So let's do the common bile duct and just measure that for us, and then store an image of that.
Alright, take a big breath in for me. Breathe.
Yeah, I can measure that when you're ready.
Sure.
So if you're
Yes.
If your patient
Take a
is,
picture.
what are you getting? 4.2, okay. If your patient's 47 years old and still has a gallbladder, what's the limit of the common bile duct?
It's 1 millimeter per decade up to 6 millimeters.
Okay, so 47 would be.
This would be normal for her.
Alright. I don't know if she's 47. She looks 35. All right, let's go over to the kidney. So show me this is a longitudinal image of the kidney, either one.
Alright, big breath in.
Okay. And then let's say somebody has a DVT that goes up into this is just bonus. DVT goes all the way up into the iliac vein.